classification, we classified the nervous system part according to the function. According to the function. Okay. And that's why I call functional classification. Okay. Or organization. How? Because the nervous system has many, many functions. And that different and variety of function through many subsystems. Subsystems, as we will see later on. Okay. So, as I mentioned, that the nervous system divided to subparts according to the function. What are these parts? Now, this is the section, as we said, to the spinal, the cerebral cortex, the frontal, occipital, parietal, temporal, and the cerebral hemisphere, because each side, left side and right side, at that area in the cerebral hemisphere, cerebral cortex, which is a very important part of the central nervous system. At that part, the highest nervous system function is carried out. Cerebral cortex at that level. Okay. In the anterior part or anterior half of the cerebral cortex or hemisphere is the frontal lobe. And in the frontal lobe, as you will see, there is area called prefrontal. Prefrontal. And that deal with the, what we call it, the executive functions. الأوامر الإدارية. الأوامر. I want to go, I want to raise my hand. All these are executive functions. It's carried out by the prefrontal part of the frontal lobe. So, this is the frontal lobe. This is the motor area. At that motor area, the motor signal started. Now, we have another area. It's called premotor area. The premotor area, which is very important for organization, planning of the movement. And also, we have this area, which is very important. This is called the prefrontal. So we have premotor, we have motor, premotor, and prefrontal. The prefrontal is the most anterior part. It is related to the personality, to the emotion, and to the decision making. قرارات. So the frontal lobe contains very important sub-system or sub-areas. We have the motor area for movement. We have the pre-motor for planning. Okay, I can move my hand. But for example, I want to take that batteries up. How I plan? I have to proceed my hand, take the batteries, and lift it up. This is planning. This is pre-motor. And this premotor, it is mature as the human being gets older and older. That's why, for example, in children, they cannot do that. Not because they are paralyzed or have no power. They have power, but they don't have the planning. أعطيكم مثل واضح. No, the child, he cannot dress himself. ما يقدر يلبس حاله. But he got the power, he's not paralyzed. But he don't know how to dress himself. Okay? For example, to take the shirt, put the right arm in the right sleeve, left arm in the left sleeve. This is planning. This is premotor. And the prefrontal is the, which is very important, is the area where decisions making, emotions, and behavior. Also in the motor area we have the Broca's area, which is related to the vision. Because in the vision we have Wernicke's and Broca's. True or false? False. Broca's area is dealing with what?
Speak.
Speech. Taboo. خليكم معي. Because when I ask a question, you understand my question.
Yes.
And that, an area of the brain called Wernicke's area. And the paratemporal area, هشوفها بعدين. And that give order to the Broca's area, which is the motor area, to initiate the speech. So we have efferent and efferent, Broca and Wernicke's. Be careful. Okay. Now, these are different areas of the brain. Frontal lobe, we have the motor area, where signals of the motor, and the body is represented in that area, in that red area. And the representation is upside down. The foot and the leg is up, upper part. Then we have the trunk, then the head and the face down. And here are the signals, motor signals started. This is the primary motor area. And here we have the premotor area. Premotor area, which is very important for planning. Planning coordinations of movement. And we have also the prefrontal, and this is for executive behavior functions. And also we have the frontal eye field, frontal eye center, very important. So the motor area contains a lot of subsystem, sub-functions. And this frontal area, frontal eye field, very important for the voluntary rapid eye movement. When I move my eyes to that side or to that side, rapid eye movement, frontal eye field center. Okay, this is the anterior part. What about the posterior part? We have, it deals with perceptions of the environment. Because at that area, we have many sensations, like visual sensations, so perceptions of around you, surround you. You are now in this hall, you know where are you, on the left side or right side, and this is the posterior. So, this is a section of the cerebral cortex again, and we have, for example, many areas. We have the motor area, we have the premotor area, and we have the frontal area. And also we have frontal eye field, and also we have speech center, Broca. because we have another speech center, burning. That sensory receptor. When I ask you questions, the question goes there. Make analysis, like a dictionary. For example, I ask you, what's your name? You understand that my questions about your name. So immediately you send impulses to the motor area, the Broca's area, and that gives you the answer. This is more detailed. Motor, premotor. This is the motor area, premotor, premotor. Also, we have many other areas in the cerebral cortex. Also, as I mentioned, that the cerebral cortex, we have two sides. Left side, left cerebral hemisphere, and right cerebral hemisphere. And each side has a specific function. Specific function. For example, if we go to the left hemisphere, the left brain function, left hemisphere, you see there are many, many functions. And the most important, for example, is the motor function, especially most of the people, the dominant hemisphere is the left side, left hemisphere. So it has motor function, right hand control. Also, it has another functions, for example. It deals with the language, spoken language, certain skills, reasoning, and also for the written language, because the language is of two types. Verbal language, talking, and written language, writing. And the language disorders اللي هنتكلم عليها بعدين could be in the verbal side or in the written side, depend on the disease. And also, the left side deals with the numbers, skills. On the other hand, the right side, it deals with the left hand movement and other functions like the music awareness, imagination, art, and also insight. Okay. Physiologically, as I mentioned, that the nervous system has many functions through subsystem. Okay. What are these subsystems? We start with very important function is the motor function. Lower. And that motor function is carried out through motor system. Motor system. The other name for it called pyramidal system. Why called pyramidal system? Because as you will see later on, the shape is like pyramid. And that motor system is responsible for different movement of different parts of the body. Each side of the cerebral cortex controls the opposite side. You see later on. Now, how the movement is initiated? I move my hand up and down. It is initiated through the contraction and controlled relaxation of a group of muscles and never a single muscle. And in any movement, you have contraction, relaxation through a group of muscles. Okay. Okay. Now, so the motor functions start with the motor system, start in the motor area. And for any movement, we have subsystem. اسمح لي شوية. تفضل. إيه أخذ أذن يعني. استأذن. ما يخالف. شكرا. Okay. Now, also we have another system which helps the primary motor system, and that's the cerebellum. And the cerebellum is a complement function, مكمل. Okay? And it helps that any movement is coordinated. Otherwise, if it is not coordinated, it will go from side to side. That is cerebellum. And also, each movement have different timing. So our coordination and timing of the contraction and relaxation of the muscle fiber. Okay. We have another system called extrapyramidal system. وحكينا انه البرايمري موتور سيستم سميناه برايمري pyramidal. اكو extra pyramidal اللي هو البيزال ganglia. And it is also a complement function of the motor system. Give the movement its smoothness and nice shape. So the cerebellum helps the primary motor system for timing, coordination. The extrapyramidal, it helps the motor system give the movement the normal shape and smoothness of any motor. While the motor area, that one, in that area we have the ignition of the motor signal. So the ignition started in the motor system, then cerebellar system helped, and extrapyramidal system helped. So that's a diagram. This is the cerebral cortex, brainstem. And here in the cortex, it functions the main motor system. And you have two other systems. The cerebellar system, it helps. طبعا the connections of the cerebellar system go through the thalamus. Okay. And the basal ganglia for the smoothness. So we have the primary motor system, cerebellar system, basal ganglia. Okay. Now, the order there started, which is coordinated, smooth. It goes down. Where? To the spinal cord. To the spinal cord. And goes where? To the anterior horn cell of the spinal cord, or goes to the motor cranial nuclei in the brainstem. Then, from the anterior horn cells, we have the root, motor nerve, and muscles. So, in conclusion, a group of anterior horn cells correspond to a muscle, while cells of the motor cortex correspond to the movement. A convergent between movement with muscle. Okay. So, a summary of the motor system. We have the starting of the signal in the motor area. This is called precentral gyrus. Precentral gyrus in the motor system. In the cerebral cortex, in the frontal lobe. Signal started. And that signal will go down through what we call corticospinal tract or pyramidal tract, as we will see later on, shaped like a pyramid. Then the corticospinal tract goes down through the internal capsule. Look, this is the motor area. Signal started here. This is the corticospinal tract. It passes through the internal capsule. This is the internal capsule. And then it goes down through the brain stem, midbrain, pons, and the medulla. And below the medulla, it crosses to the opposite side. This is called direct corticospinal tract. We have remaining minor fiber. This is the anterior. This is the indirect or lateral corticospinal tract. So we start from the signal started there, corticospinal tract, internal capsule, brainstem, goes below the medulla, across to the opposite side, called lateral corticospinal, goes to the anterior horn cell, and then goes outside. Some of the fiber goes directly, but later on it crosses. The crossing is late. Okay. Now, the brain stem, which is a very important part of the brain. In the brain stem, very important, there are motor fiber coming from the motor cranial nuclei, because the brain stem contains a lot of cranial nuclei. So motor fiber coming from these nuclei. And what will happen? These fibers coming from the motor cranial nuclei will join the corticospinal tract and goes down and descends down. And the corticospinal tract, as I said, it decussates, crosses to the opposite side below the medulla and goes to the spinal cord. So this is the description. This is the motor area, corticospinal tract, internal capsule, goes from the brain stem, with the brain, on the medulla. Below the medulla, cross to the opposite side and goes to the spinal cord, to the anterior horn cell. Anterior horn cell depends on the segment of the spinal cord, depend on which part of the body you would like to control. For example, if you would like to control the upper limb, that deal with the cervical segments, 8 segments. If you are trying to control the body, the trunk, the thoracic segment. If you try to control the lower limb, the lumbosacral segment, and so on and so on. So this is the precentral gyrus here. Signal started, goes to corticospinal tract, internal capsule, brain stem, below the medulla, cross to the opposite side, go to the anterior horn side. And this is the upper motor neuron, the blue one, called upper motor neuron. From the motor area down to the anterior console. Then, from the anterior console, we have the root and the nerve, and go to the muscle. And this is the lower motor neuron. We divide it anatomical division to make it easy for you. Upper motor neuron and lower motor neuron. Now, this is a diagram to illustrate any action. For example, this person tried to hold that ball. So what will happen? We have the motor side and we have the sensory side. And of course we have the visual side. And the visual side locates the ball, and that ball, okay, should be controlled, so you need the motor area. And that's the corticospinal tract, peripheral nerve, goes to the muscle to hold. And you need a sensation that the ball is being held. And that you need the sensory system. Sensory nerve goes up to the brain, to the sensory cortex. So we have primary motor cortex, we have primary sensory cortex. Okay. This is another description. This person like to hold that cup. So we have many stages. For example, we have stage 1, number 1. We have the information through the visual system to see the cup, where is it? Then we have the motor action, started from the motor area, frontal lobes, the motor signal to hold the cup. And this is the sensory area. Okay. So, as I said, the motor area called the precentral gyrus, and the precentral gyrus, it is all the body is represented there upside down. Okay? So the foot, leg up, and the head down. Leg down. Okay? So representation of the movement of different parts of the body represented upside down, as we said, foot, leg, thighs, hand, face, tongue, and so on. Right. So these are the area, motor area, represented upside down, foot up, tongue down. This is called the motor area, and this is called the sensory area. Okay. They found that, you notice, there is wide representation from the foot down to the tongue. And because of that wide representation, so when there is any lesion at the precentral gyrus or motor area, that will give us a focal sign. Focal sign because of the wide representation. So for example, the patient will have weakness of one limb on the opposite side, monoplia. So the wide representation of the body, this leads to the limited functional loss. Okay. For example, monoplegia, when the precentral gyrus, due to a stroke, due to occlusions of the anterior cerebral artery، هنتكلم عليها بالمحاضرة الجاية. Okay. So نظل احنا we keep repeating it حتى تتذكروها. نرجع مرة ثانية على الموtor system, which is divided into upper motor neuron, and the upper motor neuron include the fibers from the motor cerebral cortex down to the anterior horn cells. And this is called the corticospinal tract, which is say below the middle. This is the upper motor neuron, from the central gyrus, sternal capsule, brainstem, and then to the anterior horn cell. This is the upper motor neuron, from there to there. From the anterior horn cell to the root, to the nerve, to the muscle. This is a lower motor neuron. ولهذا دائما تسألون حتى بالامتحان يجي واحد عنده weakness. The first question, is it an upper motor neuron problem or a lower motor neuron problem? Because the upper motor neuron problem has certain characters and the lower motor neuron also has a special character. This is again the precentral gyrus, corticospinal tract, internal capsule, go to the brainstem, midbrain, and bones and the medulla, below the medulla, cross to the opposite side, body to the anterior side. Okay. This is the upper. What about now? What about lesions of the upper motor neuron? What sort of signs? So we have lesion above the decussation, lesion here, from there to there, upper motor neuron, above decussation. What are the signs? The signs are the following. Number one, there is loss of some voluntary movement on the opposite side. This is number one. And number two, the reflexes preserved, probably increase, hyperreflexia. And this is the difference between upper motor neuron and lower motor neuron. Because upper motor neuron give hyperreflexia, lower motor neuron hyporeflexia. So there's increase in the reflex activity, hyperreflexia. And why we got hyperreflexia? This is because of the loss of the inhibitory action of the upper motor neuron on the lower motor neuron. The upper motor neuron has inhibitory function on the lower motor neuron. So when the upper motor neuron problem, this inhibitory function will be stopped. So there is hyperfunction, like hyperreflexia and hypertonia. Okay. So increase in the reflexes, hyperreflexia. So in the upper motor neuron, we have two types of phenomena. We have positive and we have negative. The positive one is hyperreflexia. The negative one is the weakness, voluntary movement on the opposite side. Okay. So, conclusion, signs of upper motor neuron. Number one, muscle paralysis of the body on the opposite side. Number two, tone is increased, hypertonia. And the hypertonia is called spasticity. spasticity, increase in the tone. When you move by the examiner, you find the tone is increased, called spasticity. And why called spasticity? Because the tone is increased in the initial phase of the movement. It starts with increase in the tone, and then it gives way. Increase in the tone and gives way. Spasticity. Okay. And this spasticity of hypertonia has what we call it pyramidal distribution. شو نقصد بالpyramidal distribution؟ انتبهوا لأمان. The tone are increased, okay, and the flexors muscle of the upper limb and extensors muscles of the lower limb. ولهذا شوف إذا واحد عنده stroke severe and the stroke is upper motor neuron, so there is hypertonia. Hypertonia in the flexors of the upper limb and extensors of the lower limb. So what will happen? This side is weak, but hypertonia. So the upper limb is flexed, adducted, and the lower limb is extended. So when he walk like this. This is called pyramidal distribution of the hypertonia. Okay. Also other signs, we have hyperreflexia, and when you do another reflexes, like the plantar reflex, Babinski, you find extensor goes up. راح تجون ان شاء الله اسبوع مو هذا الاسبوع الجاي الاسبوع اللي بعده على كلينيكال نعمل لكم demonstration how to examine for plantar reflex, and this is all on the opposite side. The fifth character, the abdominal reflexes will be lost. When you examine the abdominal reflexes, there is no abdominal reflexes and signs of upper motor neuron. Also, there is no muscle atrophy, but there is long-term disuse atrophy. And the muscle not atrophied, لكن they can paralyze because upper motor neuron. For a long time, the cells getting smaller, called disuse atrophy. وهذا يفرقها عن اللور motor neuron هنشوفها بعدين. When you do an electrical study of the muscle, it is normal. Normal. Okay. So this is the upper motor neuron. We finish with the upper motor neuron. واضحة؟
Yes.
واضح؟ في سؤال؟ شباب؟ ولا نمتوا؟ ها؟ واضح على الأبر موتور نيورون؟ هذا مهم جدا لأن هو هذا البيزك اوف النيورون. دائما من نشوف ويكنس يقول لك هذا أبر موتور نيورون ولا لور موتور نيورون، لأنه اناتوميكلي بيختلف. الأبر موتور نيورون from here brain to the spine. lower motor neuron from the spinal cord to this. هسه عرفنا الكاركتر of the upper motor neuron. أعطيكم استراحة ولا نكمل؟ استراحة؟ استراحة؟ استراحة 5 دقايق؟ لا ربع ساعة كثير لأن محاضرة ثانية ومحاضرة ثانية تتأخرون بالأخير بعدين 10 دقايق 10 دقايق يلا خذوا راحتكم